Welcome back to my channel. If you are new here, I'm Chris and I'm a medical doctor and PhD candidate in epidemiology. And I'm also helping the healthcare professionals to relocate to another country. Today in this video, I will explain to you about supervisions, especially if you are IMG and went to work as a GP in Australia. So let's get into it. And if you are IMG with limited registrations, you must need supervision. So I will explain a little bit about the general understandings of supervisions, whether you work as a GP or whether you went to work as a RMO positions or junior medical officer positions in Australia. If you are IMG with limited registrations, you must need supervisions if you work in Australia. So the type of supervisions depend on what kind of registrations you have. And your registration is limited registrations, like areas of need is common in GP, or your registrations is limited for postgraduate trainees or supervised practice is very common in hospital settings. And it also depends on your experience and assessment status. So after AMC exam and previous overseas practice or prior Australia experience or something like that. If you are IMG with limited registration, so this is a general rule. You must always practice under supervisions that was approved by the Medical Board of Australia. And your level of supervisions is determined during your registrations applications based on your background, and the supervision plan and supervisor agreement must be lodged with APRA before you start working in Australia. So your supervisor send a regular report, usually 3 to 6 months to APRA to confirm your progress. So this is the general understandings of supervisions, whether you work as a doctors in the hospital settings or in a general practice in Australia. But it's a bit different when you are searching a job. If you went to apply as RMO positions or hospital settings positions, you don't need to consider about the supervisions is available or not. Just applying it, and you got the interviews, and you can sit the interview and you can work in there. But in the general practice, it's not the same. When you are searching or when you are hunting a job, you must carefully search for these positions is available with supervisions or not. Australia is they have a shortage of GP, and every positions or every GP positions they cannot provide a supervisor to you, especially for IMG. So for IMG, you must practice in there with supervision. So if they mentioned in the vacancy supervisions is available, or this position is these positions you have to work under level 2 supervisions or level 1 supervisions, level 3, level 4, something like that. And if you don't understand about the level of supervisions and you just applying it, so you didn't hear anything from your employer, it's a waste of time. So you must understand the level of supervisions and how you search a GP vacancy with what kind of supervision. So okay, let's move into the general practice with supervisions. And for the GP, most of the IMG with limited registration start at level 1 or level 2 supervisions. If you are new to Australia practice, supervisions is really important and needed. So I will explain the level of supervision. So They have a 4 level of supervisions: level 1 supervisions, level 2 supervisions, level 3 supervisions, and level 4 supervisions. So level 1 supervisions is the highest and 4 is the lowest and nearly independent. If you are a new IMG, this is the first job in Australia, not familiar with the system, you must need supervisions level 1. Your supervisor must be on site and available at all the time, and all the consultations may need to be directly observed by your supervisors initially, and you must discuss all the cases with supervisors before your patients leave the clinics. So how long you have to work on supervisors as a level 1? So usually it takes 3 to 6 months for IMG practice. And for the level 2 supervisions, you are supervisor on site most of the time. For level 1, all the time. So for level 2, you are supervisor on site most of the time. Some patients you can see independently, but you must discuss complex cases and emergency cases. So your supervisor reviews selected records daily, not all the case, selected case, especially for the complex cases and emergency cases. So level 2, usually after a positive workplace-based assessment at level 1. So level 1 to level 2 is a kind of progressions. For level 3 supervisions, your supervisors not required to be on site or at all the time. So it means that your supervisor will not be available at all the time. It might be frequent on and off. So your supervisor must be available by phone or video for immediate advice. So you can get some supervisions maybe online or on site. And your supervisor must conduct regular case review and audits. So this is another tip. If you want to work as a GP in Australia, the audit experience is required. So this is just additional information. So for level 3 supervisions, your supervisors not required on the site all the time. You can contact to him or to her by phone or video call for immediate advice, and your supervisor must conduct regular case review or clinical audits. And you can consult independently but still within supervision plan. And mostly the level 3 supervisions will take 6 to 12 months before you move into the level 4. For level 4 supervisions is the lowest and nearly independent. So your supervisor off-site, and only available for consultations as needed. And your supervisors must periodically review practice performance, like a monthly or maybe quarterly. And your function mostly as an unsupervised GP. This is the final stage before progressing to your full general registrations or before you are starting with your fellowships training. So they have 4 levels of supervisions: level 1, 2, 3, and 4. You can move from level to level, like a supervision level 1 to level 2. After workplace performance review, your supervisor report and medical board approval. So durations may be mostly IMG spends each level about 3 to 6 months per level, and sometimes it can take longer, but it depends on your experience and your performance or your examinations. If you pass the exam quickly, you can move to another level. So it depends on how long you take your exam. And supervision is linked to location. So if you change the job and you need new approval, so it's important when you are planning to switch a job from supervision with supervisions to another places, so you still require supervisions before you are getting full registrations. So you can, if you want to review in detail, you can search the websites Medical Board of Australia Supervised Practice Guideline. And so what? How can I get the GP positions with supervisions? So sometimes they mentioned this positions is you can get available the supervisions, and some vacancies they didn't mention, and you need to know. Sometimes they mention like this is the level 3. If you are IMG with no experience in Australia, you are not eligible to apply the level 3. Most IMG need level 1 and level 2 supervision. So you can apply with supervisions level 1 and 2 available job, especially for GP. So where can I find the GP positions that they offer with supervision? So they have mainly job resources like a RAC GP job board or ACRM carrier, and PHA primary health network job portals, and some recruitment websites, and you can apply directly rural workforce agencies like its respective province or respective state. They have their own websites like New South Wales, Victoria, Queensland, South Australia, WA, Tasmania, Northern Territory. They have their own websites to recruit their general practitioners. So sometimes you can directly contact with the clinic. I went to apply the positions with supervisions level 1 or 2. You can directly contact to the clinic HR or clinic in charge, and they will reply to you. They have vacancy, but they cannot provide the supervisions, so you can talk with them openly, and they will reply to you. So this is very important when you are searching or when you are landing a job at GP in Australia. And we have a good news to you. We know that you are difficulties when you are finding a job, and we provide some vacancy with supervisions in our website globaljob4you.info. You can find some GP position with supervisions level 1 and 2. So please visit to our international job website globaljob4you.info. You can find some vacancy with supervisions. I hope this video is good for you if you are struggling to find a GP job with supervisions in Australia. See you in my next video.